Anyari must money must come down dining. This must money must carry your disease and a prostate disease. By way of introduction, prostate is an organ like a kind of royal, a bone baby in any organ on a prostate. And prostate, Anna Ma was on up to the time and I can we so you have the prostate. So on anyone so that it will improve the viability of the sperm. That is don't make a sperm on your catheter or a corona or come, which is reproduction, right? So the prostate is there to help the sperm to carry out its function, to give the sperm the viability it requires to carry out the coronary or reproduction. Therefore, prostate it is around, Enwa honoro, that is the penile area, honoro, the penile area prostate here. So the prostate, the more no does any right, it tends to increase in size. However, the rate of increase in others differ even in Arabic. Amos will increase at higher rate than or in Mr. B. So therefore, but however, the more as long as you are advancing in age, it tends to enlarge. So therefore, if you tend to live, for a very long duration of years, you are more likely to come down with this disease. So on this scenario, prostate enlargement condition, that is conditions that diseases that occur due to enlargement of the prostate tends to as it's happen due to a binary prostate on a banana. In a 50 years or 45 years upward on affecting, unlike people who are younger than 45 years, like my age mate or other people who are younger than 45 years, they hardly come down with signs and symptoms related to prostatic enlargement, and then have come out with signs of prostate enlarged. So this short video is actually directed to men who are 45, 50 years and above. So therefore, one year or anybody from 45 years and 45 years upward, please try to ensure you pass this knowledge to them. No one is an island, just so that they are cautious of their health. Secondly, prostate is commonly occur among the black azogi or affected who know even any prostate but the azogi or affect the body who even. So therefore, because I'm making this video because of so many misconceptions. Because I've seen in our Korea as well with urinary problems, people who are 45, 50 years and above with problem in your area, that some of those quack people they may treat them for diabetes or infection. Therefore, either complicating prostate or giving them complication of treatment, diabetes, and they treat them coming down with hypoglycemia or other complications due to their own treatment. Whereas they may, when they are in 50 years, 45 years above, look at the prostate not affecting, and then these quacks and then they are not even addressing it. Because, alright, I'll come to the complication later. So that's why I decided to make this video. So it's sign like a laborani, though show that prostate is affecting. But you should note that my prostate was already enough to affect them. So, how will I look at my affect them? There's a time when I hire a hole more than 2 times, more than 3 times, 4 times, most likely all but they wake up more frequently at night to pass urine. Then all the car from any river in a horror and into which we call frequency of urine. The former we call it nocturia. This one we call it frequency of nicturation or of passing urine. They go to the toilet frequency to go and pass urine. They count every 2 hours, every 3 hours, every 3.5 hours, this is another sign that prostate especially around 45 years upward or 50 years, especially 50 years upward. Think of prostate. Or the cow can be in Yapene. That night can on the toilet, the indoor genovo, even if you keep attacking on the toilet, the indoor genovo, which we call organ continence. Or the cow car, Inya and our Inya Quene, I mean, and I was okay in the toilet, even tipataki, a hinyove, which we call, straining. They will strain very well before you ring Gavanka or hesitancy. But it's and they have problem or initiate taking or a hinyos in my way, a hinot kind of another jet. Then they continue. The here pause. I have it. Or the cow can really hit it. Then the hino quarto, that drop, which we call terminal dribbling. Or the cow. And the stream of the urine is very poor. It is quite poor. Every as in only pressure. All to before you see it is we say they are saying my head can really and no the pattern if you put again like a var can it doesn't really come. Or in the worst case scenario, air could say in your toilet. They don't even have that urge of even holding it before getting to the toilet. They can draw working all the time. And in the worst case scenario, especially when they are poorly treated or in complicated ones, the common complication like our from prostate enlargement and the acute urine retention, they need to accumulate in the bladder, they tick in the head, you can't even tell the blood. I can tell again, which is a bladder, may accumulate. And this has caused a lot of death. My maternal grandfather, I was just told recently that it was one of the things that that killed him during those days in the village, because of awareness, which were taken to a proper facility, a proper doctor at least. Or if I will comment on living and then now place them on the appropriate treatment. So, one man in Nigeria was an outbreak, no symptom or sign difficulty in your healing. Please look for the closest medical personnel that make our trust in, especially a doctor, a nurse, any personnel who are trust careers or any idea in medicine. Meet the person, don't give our advice, or take this your elderly person, show them I'm scanning your just normal ultrasound scan this your stomach. Then it is what they put it on or I enlighten that effect and heaven. Although I test and I want to call it, but this is the commonest, affordable, less invasive test like our and readily available. What is only a prostate or every prostate, especially if this person is from 45-50 years and above. Don't go and let your elderly parent or elderly guardian to fall into the hands of these criminals and quacks. Then you may treat him for something completely different. Because one most likely prostate, then you could look for the appropriate, medical doctor to, carry out the required treatment. It is treatable. It is even curable if at all you present early to the appropriate and qualified medical personnel. Because if you don't, the complication can be very deadly. It can be very, very fatal. It can cause, kidney failure. And where is cancerous, most of us, it's a cancer of course. Either the prostate, place of a cancer, any benign, prostatic enlargement, any cancer of the prostate, otherwise known as CAP, then other one, which is prostatitis. These are the three classification of diseases that affect the prostate. But most any cause problem and in whichever one it is, if you present early to the hospital, be it prostatitis, be it benign prostatic hyperplasia, or be it cancer of the prostate. If you present early pneumonia severity, it can be treated, and then your person, your guardian, your father, whoever he is, will live his life without any struggle. So prevention, they say, is better than cure. Early presentation, early detection is the key. That's as long as honorable you have prostate in you. So it is advisable that every man, accountable from 45 years upward. Firstly, the general advice of a clinical, one above 45 years and above, you should start meeting your doctor. Don't be what we call digital rectal examination, or maybe yearly or every 6 months. Yearly is preferable, so that all made digital rectal examination, which we call DRE, all male will detect prostate and oxygen mapine before that one carry anymore or if it's symptom. And routinely, you can just go on your own. I mean, scanning. Wow, once you are 45, 50 years, just go and do scans to really what is the rate of enlargement in prostate. Then what we are doing, we follow and up. Or as soon as you may feel any symptom or not, go and discuss with your doctor. Then don't give out necessary advice and how to prevent it. So please pass this message to Hawaii, especially those from 45, 50 years and above, and especially those who are not getting sign and symptom economic action. Every hour, every 2 hours, 3 hours, from me and moving, I may hit him. He not water and can now toilet, every to cheat in to our one, and the host of other can really this system. So let's try as much as possible to be in control of our health. Early detection, early treatment, and early visit to the appropriate and qualified medical personnel. It is the key, or it's the condition. It is treatable. I will treat and I will cure and the appropriate medical personnel too. So with us and with you, we can improve the health of our loved ones. I will shape